Welcome back to my channel. If you're new here, my name is Neil Galvin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational videos twice a week. Please make sure to subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends, because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everyone, how are you guys doing? Wherever you are right now, whatever time zone you are watching me right now, I wish you good morning, good afternoon, and good night, just in case I don't get to see you. How are you guys? Yeah, it's another day for lecture, and like you're seeing on your screens right now, today we're going to be discussing oxygen delivery methods. Now, this is a pretty comprehensive list of the delivery devices, oxygen O2 devices that we normally give or we normally have in the unit to deliver oxygen to our patients. Now, just a brief overview. We all know the importance of oxygen to maintain the homeostasis of the state of balance in our patient's body, and oxygen is normally is the one that we use to convert that is being converted to ATP to serve as a source of our energy. And that's why our main goal is to make sure that we give the patient is on the right level. They're receiving their O2 saturation and their oxygen wise, ventilation wise, is at the topmost, and the highest priority. That's why if you can see on the nursing prioritization, you kind of like do it ABC, right? Airway, breathing, and then circulation. Now that will vary, that will change if the patient is, let's say, experiencing chest pain or something, because that will change into CAB, circulation, airway, and breathing. But definitely we want to make sure that we are giving sufficient amount of oxygen to our patients, considering that they don't have any pre-existing conditions such as COPD, such as asthma, emphysema, those kind of stuff. Why? Because to those patients we have target oxygen level. All right, so before I further proceed, I would just like to give this allow me to have this opportunity to thank all of you guys for keep on supporting and being there for me all throughout since the start of my journey in my channel. I want to thank you from the bottom of my heart. We are moving towards 25,000 subscribers, if you haven't know that already. So none of that will be possible if it wasn't because of you guys. So thank you very much. If you haven't watched this is actually, I'm gonna put this in the critical nursing playlist. If you haven't watched the other critical nursing topics I created under my under this channel, I'll be putting the playlist link on the description box, or whenever the icon button pops out, click the one out, because I'll be putting it there too, together with the other playlist I have on my channel. I actually created tons of nursing lectures all for you for free. And let me know, because I'm starting a Patreon to my channel. I just found out that I am eligible. So let me know if you have a copy, if you want to have a copy of this lecture materials that I'm having, that I created for myself, and I'll be more than happy to share it to you. I'll set up my Patreon account on my YouTube channel in order for you to avail this, okay? So, but for now, just chill, okay? So I'm working on it. Now, we're going to go straight to our topic for today. In terms of the oxygen delivery methods, I'm going to divide this into 5 categories, or as you can see, there's columns here. So 5 chapters. Each delivery methods or each devices, I am going to tell you the description. I'm going to give you a brief description, the FiO2 and flow rate that you're going to be expecting from them, how much liter of oxygen or saturation you're getting from each devices, the indication for using each one, and what are the risks that whenever you use them. There's actually disadvantages of using these devices, and all of that and more are the things that we're going to be talking about today. So without further ado, magsimula na tayo. Oh, by the way, before I further proceed, I'm gonna give you time to hit the notif bell and that subscribe button so you'll be updated on my future uploads. All right, thank you so much for doing that. You guys are amazing. I appreciate. Now let's proceed. So as you can see on our oxygen delivery methods here, I have here 6 devices. And we're going to tackle them one by one. First up, we're going to have nasal cannula. So yeah, if you haven't seen a nasal cannula, this is how it looks like. It's basically the first step in giving giving oxygen to a patient or starting an O2 therapy. First step and normally the last step. Okay? Whenever you try to win off the patient, pababa ng pababa yung paggamit natin ng delivery, ng oxygen delivery devices natin. So the first one is nasal cannula. And this one looks like a nasal prongs that sit in the nares. This part right here, this one, you're going to put it on the nasal nares. All right, so nasal prongs that sit in the nares. Now, how much FiO2 inflow rate you can give or you can use whenever you use a nasal cannula, a simple nasal cannula? So, as you can see here, it says 1 to 6 liters per minute. That's the maximum. But normally in the facility, I don't think if you can get that much when you raise it to 6. Normally, it's 1 to 4, okay? So some books say 1 to 6, some books say 1 to 4. So, but in this discussion, we're going to go with 1 to 6 liters per minute. In terms of the saturation level of the total saturation, you can, amount of oxygen you can get FiO2. It's 24 to 44% of FiO2. Now, there's some key points I want you to be mindful of. Ano ba nangyayari? 1 liter, be mindful that 1 liter per minute delivers an FiO2 of 24%. So, every 1 liter, you can add a 4%. So, if you're going to add 1 liter of oxygen, let's say from 1 liters per minute, you're going to move up to 2 liters per minute in the event that the patient is not responding or still experiencing desaturation. So remember that when you add 1 liters, you will add 4% of FiO2 to that. All right. So yeah, so those are the FiO2 and flow rate numbers and figures that you can expect whenever you use a nasal cannula. How about the indication? When is the time that you're going to use this device, nasal cannula? So whenever your patient is having mild shortness of breath, asthma, or whenever your patient is diagnosed with COPD, cystic fibrosis, CF, pneumonia, to ease work of breathing. Kasi kadalasan yung mga patient natin who are diagnosed with COPD, they're normally having this labored breathing, or whenever they're having that labored breathing, you want to assist them. And like I said, be mindful whenever you are giving it, you're starting an O2 therapy to a COPD patient kasi normally may target tayo dyan. Target O2 sat. Normally, based on my experience, 88 to 94 or ibang doktor, 88 to 92. Okay? So why? Why is this? Because lumalabas din to sa board exam itong tanong na to. Because you don't wanna have oxygen retention to the patient who is considered to have COPD. All right? Kasi you wanna make sure that there's equal balance between the oxygen and the carbon dioxide. Carbon dioxide being the number one stimuli for breathing. All right. So moving on, what are the risks of using nasal cannula? So we have here mucosal drying, skin breakdown, and skin breakdown at nares and ears. Now, mucosal drying actually results if whenever you are putting nasal cannula or any of this oxygen devices, delivery devices, and you forgot to you have to attach them in a humidifier, and that humidifier you should put normal saline. It should not be kept dry or left dry. Why? Because it can cause mucosal drying. Mucosal drying can lead to mucosal irritation. which is actually irreversible. So you want to make sure that you supply not just oxygen but humid to the patient to prevent mucosal drying and skin breakdown. Okay? All right. So we're done with nasal cannula. We're going to proceed with the next step. So if nasal cannula is not effective, mag-proceed ka sa face mask. When you say not effective, meaning the patient is still tachypnic, the patient is still showing labored breathing, desaturation, all of those stuff. So nasal cannula moving up to face mask. If you haven't seen a face mask before, this is how it looks like. So the same as your nasal cannula, this one is also going, may tube dyan, and you will attach it to humidifier and you will regulate the oxygen accordingly, according to the order. Now, in terms of description, let me describe it to you, okay? Standard face mask that covers the nose and the mouth. Yes, this one right here, it covers your nose, meron dyang bakal, and pasakop siya hanggang sa bunganga. So, face mask. All right, so FiO2 and flow rate. In terms of that, you can normally, when you use face mask, it's normally given in this flow rate, 6 to 10 liters per minute. So mapapansin nyo, tumataas yung flow rate na ginagamit natin as we go down on this list. From 1 to 6, nasal cannula, and now you're moving to face mask, 6 to 10. Why is that? Meaning, tumataas ang oxygen demand. The oxygen demand of your patient is increasing. So, 6 to 10 liters per minute, and that is equivalent to 40 to 60% FiO2. Now, there's some key points here, and I want you to focus here. If the simple mask has a reservoir on it or by that is attached to it, it is called a partial rebreather mask. This will deliver an FiO2 of 50 to 60%. This is a bit confusing because non-rebreather, which is we're gonna tackle that later, normally looks like a face mask, but the difference is that you can tell that it's a non-rebreather non-rebreather mask, or what you might call this, a partial rebreather mask, if you can see here like a small reservoir. Same like this, attach this bag, attached to this. Okay, but it definitely looks like a face mask. Non-rebreather mask normally looks like this. Okay ha? Huwag malilito. At makikita mo naman yun sa packaging. You can read the packaging before you open it of what type of delivery device are you using. Small details can really can really place a lot in delivering correct oxygen or delivering effective oxygen to your patients, okay? So just read the packaging of the device before you open them. Next, when are you going to use your simple face mask? So if nasal cannula NC is insufficient, di ba what I told you? Pataas po ng pataas. Gradual tayo. Hindi po pwede. Depende sa kaso ng pasyente ha. But normally, typically we start with nasal cannula, then we move to face mask if the nasal cannula is ineffective and or mild respiratory distress is being noticed to your patient. Meaning, hirap pa rin sa paghinga ang pasyente, labored breathing, desaturation, tachypnea, all of those stuff. And sapahan mo pa yan ng blood gases mo that could tell you that the nasal cannula is actually ineffective. Okay, so what are the risks of using face masks? Meron po. We have risks. You can develop, or if patient is having claustrophobia, medyo mahigpit kasi ang kapit nito sa tenga ng pasyente. Meron tong parang garter na i-attach mo dun sa likod at the back of the patient's head. So claustrophobia, CO2 retention could show up, CO2 build up on low flow rates, and cannot eat or drink while wearing may not fit well. So meaning since ang delivery nito, ang tinatarget niya is yung nose and your mouth, your patient may actually have a hard time eating or drinking or talking. And some face masks, if hindi masyadong maayos ang pagkakalagay or hindi available yung mga sizes, may not fit well to your patient, leading to ineffective delivery of oxygen. So are we good with your face mask? All right. So we're going to proceed with your non-rebreather mask. So if you haven't seen a non-rebreather mask, this is how it looks like. Okie doke. So, like the other oxygen devices we have, meron pa rin yan naka-attach na tube dyan natin ang ilalagay mo doon sa humidifier. So, yeah, non-rebreather mask. So, let me describe this to you. It has a valve on the exhalation port. This valve right here. Okay. And exhalation port in between the reservoir, bag, and mask. The valves prevent room air from coming into the system. Make sure that the reservoir remains at least 1 and a half full on inspiration. 1 and a half full. So, isa yun sa mga, normally kapag mag-a-apply ka, magsa-start ka ng NRB, non-rebreathing face mask, para mapuno mo tong reservoir na to, dito sa loob ng face mask na to, nandyan yung valve. Okay, so you're gonna put your finger on top of it, and then you're gonna open the oxygen so that mapuno ito ng oxygen, ng hangin. Now, you want to make sure that it's effectively delivered. Pag huminga ang pasyente, dapat 1 and a half full pa rin itong reservoir na to. Nagigets? Hindi siya fully emptied during inspiration. Inspiration, hindi expiration. Okay? Baka ikaw ang mag-expire. Alright. So, malinaw ba yon? Malinaw. Now, in terms of FiO2 and flow rate, you guys, when you're gonna use your non-rebreather mask, you can deliver up to 10 to 15 liters per minute of oxygen. In terms of FiO2 and the saturation amount, when you use non-rebreather, you can deliver up to tumataginting ng 95%. So meaning, what does this list tell you? As you go down, as you move from nasal cannula to non-rebreather until your bag valve, the oxygen demand of your patient is increasing. That's why you're using much bigger dose of oxygen delivery, okay? So when are you gonna use a non-rebreather? So if nasal cannula or simple mask are insufficient, or any traumatic injuries, any RTA, hindi siya indicated din sa mga may maxillofacial injuries. Kasi sa may kakabit, okay? So after smoke inhalation, so traumatic injuries after smoke inhalation, so best siyang gamitin. So what are the risks whenever you use a non-rebreather? So of course, yung comfort ng pasyente, mako-compromise. Uncomfortable in patient's face. Impedes patient's ability to communicate, eat, and drink. Alright? So, next we're gonna move to your Venturi masks. If you haven't seen a Venturi mask, this is how it looks like. It has these masks here, and it normally goes with ports or valves. Each valve, depending on the color, plays a significant role on how much oxygen you're going to deliver to your patient. It also comes with a tube, which you're going to attach to the humidifier. Now, let me describe this to you. It looks like a face mask with the addition of color-coded adapters that direct a specific oxygen concentration to the patient. Just like I said earlier. FiO2-wise and flow rate, you can give 2 to 15 liters per minute of oxygen and expect to have 24 to 60% of FiO2 depending on the color of the adapter. What are the indications of using your Venturi mask? Now, this is often used in persistent hypercarbia or moderate to severe hypoxemia in the case of COPD. What is hypercarbia? Hypercarbia is the excessive amount of carbon dioxide in the blood. Okay, hypercarbia. Now, this can be ruled out through your ABG, your blood gas, or your VBG, venous blood gas. All right, so what are the risks of using a Venturi mask? Now, only goes up to 60% FiO2. That's the maximum FiO2. So, not for patients who have a significant high oxygen demand, bulky. It impedes on communication as well in eating and drinking. Now, as you can see here, it's quite bulky. Yung mga mask natin medyo bulky yan, medyo nakakasira ng aesthetic, charing. Bulky po yung kanyang itsura. So those are the one of the risks whenever you use a Venturi mask. Now moving on, before we move to the last two oxygen delivery devices for today, I'm gonna give you time to subscribe and hit that notification bell. Go. Okay, welcome back. Thank you so much for doing that. You guys are amazing. Thank you po. Okay, mag-move on na tayo. So, the next one, nakakailan na ba tayo? Nakakalima na, no? O, panglima na pala to. So, we have here your high-flow nasal cannula. If you haven't seen one, this is how it looks like. Normally, ang high-flow nasal cannula natin, binibigay natin to kapag sa pasyente, last resort niya to bago siya i-intubate. Meaning, kapag hindi pa talaga effective ang saturation, nagdidisat pa rin, high-flow nasal cannula. Ito po itsura niya. Nakakonect siya sa machine, tapos meron tayong normal saline dyan para ma-make sure natin na we're also giving humidification to the patient. High-flow at normally ginagawa rin yung high-flow, ginagamit din siya post-extubation para hindi naman mabigla yung katawan ng pasyente sa pag-win off mo sa kanya sa mechanical ventilator. Okay? Don't worry, I'm gonna discuss that to you. So it looks like a thicker nasal cannula that includes an air oxygen blender, humidifier, heater, and nasal cannula. This is how it looks like again. Okay? Malinaw tayo dyan? Malinaw. In terms of flow rate in your FiO2, you can give as up to 30 to 60 liters per minute of oxygen. You see, ang taas na ng oxygen level niya. Oxygen-wise, you can give 21, you can expect to have 21 to 100% of FiO2. Diba, bongga? Now, what are the indications to which patient are you expecting to give or to administer or to use a high-flow nasal cannula? So, for patients who are considered in the worst case scenario, yung worst at hindi gumagaling na pneumonia, malalang klase ng pneumonia, post-extubation, what did I tell you? Pre-oxygenation prior to intubation, and for those patients who sign DNI, meaning do not intubate. Patients with respiratory failure. Okay? DNI patients with respiratory failure. May mga lung CA, may mga cystic fibrosis, those kind of stuff. Okay? Now, what are the risks, disadvantages of using your nasal, high-flow nasal? Well, it is apparently expensive and not typically available for home use due to its high flow rates and maintenance. Normally kasi mga healthcare providers ang mga nakakagamit niya, mga RT, respiratory therapist, or nurses. Okay? So, yeah, tapos na tayo sa ating high-flow nasal cannula. We are now moved to the last device for today's video and today's list. So the last resort that you can use before you intubate the patient is to use a bag valve mask. So if you haven't seen a bag valve mask, this is how it looks like. It has a mask here. It has a valve, a big a big bag, and a reservoir together with a tube that is being attached to your humidifier. Hindi ka pwedeng mag-bag valve mask. Common mistake to na napapansin ko. Hindi ka pwedeng gumamit nitong bag valve mask na to na hindi mo to ina-attach sa oxygen, source of oxygen mo, sa humidifier na naka-open. Why? Because it will not gonna be able to deliver the expected amount of oxygen you want for your patient. It's ineffective. So, a face mask and a reservoir bag that is positioned over the patient's nose and mouth, while forcing air into the lungs by squeezing the bag. Normally, we use this bag valve whenever we intubate the patient for pre-oxygenation, okay? Now, in terms of flow rate and FiO2, you can give 12 to 15 liters per minute. 60 to 100% naman in terms of your FiO2. O, diba? Pretty high level of oxygen. Now, when are you gonna use a bag valve mask? When are you gonna use it? So in emergent resuscitation, pag mga nag-aares na yung pasyente or urgent intubation, hypercapnic and ano pa yung isang term dito, hypercarbia, iisa lang po yan ha, wag malilito. Meaning, same sila na increase or abnormally increase amount of carbon dioxide in the blood. So, ginagamit din siya for respiratory failure patient, hypoxic with signs of respiratory failure, apnea, decreased level of consciousness siya with sa mga pasyente may inability to protect airway, meaning may possibility nagdi-DLOC ang pasyente mo from alert to pain or unresponsive, from GCS 15 to GCS 4, ganon. Okay, so what are the risks of using a bag valve mask? Now, it requires an effective seal. So meaning, proper training ang kailangan sa mga healthcare providers, lalo na sa critical area, to properly apply your bag valve mask. Meron kasi yung C-seal, CE method. Inaral natin to sa ating ACLS, BLS, okay? So it requires an effective seal in order for you to deliver oxygen properly. Provider. Yeah, it means it can also cause fatigue to the provider or the nurses or respiratory therapists or even doctors who deliver oxygen because it needs a force. So used for short-term ventilation only. Hindi siya pang long-term, hindi siya kagaya ng other devices natin na pwede siyang for 12 hours, for 6 hours, 8 hours, no. Short-term use lang siya. So once again, this is the comprehensive list I created for you that will give you your oxygen delivery devices that you can use to your patient. If you're working in the hospital, you're probably aware of these devices and you've seen one. I suggest that for you to go back, check them out. Lalo kung bago ka, familiarize yourself on how does it look like, or where you can find them in the event that you have to use them as quickly and you want to get access to them as quickly as possible. And dyan na nga natatapos ang ating discussion for today. Thank you very much for watching. I hope you guys enjoy and learned something for today's video. And if you haven't already, please make sure to subscribe to my channel, hit the notification bell, and don't forget to follow me on all my other social media accounts. Everything is at Neil Gave, except for my TikTok account, which is Neil Gave Official. I'll see you again next week. You have a good one.